This is 10 minutes on topic. I'm Autumn Labbe-Renault, and today we're doing a pandemic update by way of inviting our guest, Dr. Aimee Sisson, who's the Public Health Officer for Yolo County. Thanks for joining us, Dr. Sisson. It's good to see you.
Thanks for having me.
And I just said you're the Public Health Officer. I believe your correct title is actually Health Officer, but since you work in the realm of public health, there you go. Last time we chatted, and it's been a while. I remember last year, this time we were talking, we did an interview, and it was at a rather dark moment in the pandemic. We'd had, surges and swells, and we'd gotten to this point towards the end of the year where all the numbers were pretty bad. I assume we're not there, but I really wanted to check in and see where we are in Yolo County. How are we doing with positivity rates, case rates, hospitalizations, and all of that? Please bring us up to speed.
Yeah, well, the good news is we are definitely doing better than we were a year ago, and we're doing better than we were a month ago. So, in the last month, Yolo County's case rate has decreased by about 30%. Our current case rate per 100,000 residents per day is 8.9, and that qualifies as substantial community transmission under the CDC's framework, which is a decrease from recently when we were considered high community transmission. The sort of bad news side of this is in the last week or so, our case rate has stopped declining and it's really been holding steady in the 8.8 to 9 per 100,000 residents per day. So it's certainly not going up, but it's also not going down either. We're also seeing stability in our testing positivity rate as well as our hospitalizations. So both of those metrics have been relatively steady for the last month or so.
Hmm. So also, when we talked last time, this time last year, vaccines were kind of still just a hope. They were being worked on, but the vaccine programs had not rolled out. And then the county stepped forward in such a big way with drive-through vaccine clinics and just serving amazing numbers of people. And so now here the discussion is about boosters. And when I originally reached out to you about this interview, I wanted to provide some clarification for people about who should get a booster, who qualified. And then last week, the CDC made an announcement that anyone over the age of 18 may get a booster. And they're very specific with that word may. So a couple questions there. Is the county doing similar drive-through clinics for boosters? And what does may mean? In other words, is there anybody who shouldn't get a booster?
Yeah, well, first of all, let me say how happy I am that the CDC has clarified its recommendations for who can or who may get a booster,
Right.
because I think one of the reasons why our demand has been relatively low for boosters until this last week is because everyone was so confused about who was actually eligible. We had
Yes.
may and should and recommend, and also all these very complicated based on age and underlying condition or your job or where you lived. So now it's really simple. If you're 18 or older and it's been at least 6 months since you got 2 doses of an mRNA vaccine or 2 months since you got a Johnson and Johnson vaccine, you can get a booster. So that makes things a lot simpler for everybody to understand. And as a result, we're seeing an increase in the demand for boosters. So the county is doing a pretty significant rollout to meet the demand for boosters. We have mostly up until now been doing clinics indoors, moving away from the very large drive-through clinics that we had with the
Hmm.
initial vaccine rollout. But we will be moving towards some larger drive-through clinics so that we can meet the demand for boosters, which is especially high right now. It's also occurring at the same time as we're vaccinating kids because we just had
Sure.
kids ages 5 to 11 become eligible for boosters. So we're mostly trying to get the kids vaccinated at school-based clinics. And then we have some clinics that are a mix of boosters as well as child vaccines. And then we'll have some larger drive-through clinics coming up that are really focused on booster doses.
I've noticed a number of people posting on social media their double Band-Aid pics. I got boosted and I got my flu shot. Is that, I know there are a number of private providers. You can get them at CVS and Walmart and other places. Is the county also planning to do that, offer flu shots at the same time?
Yeah, so a couple things. The double Band-Aid picks, you can absolutely get a flu vaccine and a COVID-19 vaccine on the same day at the same time. Generally, we recommend that they be put in different arms, but you can get
Mhm.
both in the same arm as long as they're at least an inch apart. But because both the flu shot and the COVID-19 shot have a tendency to cause a sore arm, they do recommend
Right.
spreading them out so you don't get one arm that's especially sore. Um, so that's our current recommendation is you can get both. We've had some flu vaccine clinics for the county that have also offered COVID-19 vaccines. We're actually done for now with our county run flu clinics, and at our county run COVID clinics, we don't offer the flu vaccine because we're doing so many different COVID vaccines. There's just the it creates room for error when you throw
Sure.
another vaccine into the mix. So we're really focused at the county on our COVID vaccines. But if somebody wants to get both flu and COVID in the same visit, I'd encourage them to go to their healthcare provider or to a retail pharmacy, and they can do that. There's one population that's particularly important to get both flu vaccine as well as the COVID booster, and that is our older adults. Right
Mhm.
now, we only have about a third of adults in Yolo County ages 65 and older who've gotten a booster dose for COVID-19 who are eligible. And we are seeing some wearing off or waning of the immunity from the first two mRNA doses, particularly in older adults, not just against infection, but also against hospitalization. So I really want to get the word out that our seniors absolutely need to get that booster dose for COVID.
Okay, well, we will help you accomplish that by today and supporting that on social media. One last question about vaccines. Is the best mechanism or the way to sign up for county clinics still the My Turn app?
It is. myturn.ca.gov is your best bet. All of our public county clinics are posted on MyTurn, and you can sign up for an appointment there. A lot of
Great.
healthcare providers also have their appointments posted on MyTurn. The pharmacies don't necessarily post their appointments on MyTurn, so in some cases you'll need to go directly to their website to make an appointment at a pharmacy.
Okay. And then finally, Dr. Sisson, we have a couple of minutes left. We're at that point. It's Thanksgiving week. As we record this, people will be traveling. They'll be getting on planes. They'll be around people they're not usually around. What's the official public health set of recommendations around that so that we don't have a huge surge following the holidays?
Well, like so many official public health recommendations, it depends. And it really depends on your vaccination status as well as any underlying vulnerabilities. So, the great news this year compared to last year when we really discouraged gathering, discouraged traveling, said if you were going to meet, it needed to be outdoors in a really small group. The good news is this
Right.
year we have vaccines. So, if your Thanksgiving gathering is of all fully vaccinated and boosted individuals, then you can have a normal Thanksgiving, what some people are calling a Vaxgiving. So happy Vaxgiving if everybody is fully vaccinated. If, however, you're in a group where not everybody is fully vaccinated, or where some people may be at high risk of severe disease or immunocompromised, that's where you're going to want to take extra precautions. You might want to have everybody test with a PCR test up to 3 days before the event, or with a rapid
Mhm.
antigen test on the day of the event, so you can be confident that nobody coming in has COVID without any symptoms. And then also test after the event to make sure when you return to work or return to school, return to your family, that you aren't bringing COVID with you. And then again, if you have vulnerable people or unvaccinated people, you're going to want to keep that group small, and you're also going to either want to meet outdoors or maximize your ventilation by having a door or window open or having a portable HEPA filter to clean the air.
Thank you so much. And on that note, Healthy Davis together. announced this week that they will be continuing the free testing services throughout Davis, and I know there's some other places in the county that happens too through the end of June 2022. So we're very fortunate here in Davis and Yolo County to have that. Once again, I've been speaking with Dr. Aimee Sisson, the health officer for Yolo County. You can go to yolocounty.org. You'll have to scroll down a little bit, but there's a link for all the COVID-19 resources that the county puts out. And I thank you so much for tuning in. And Dr. Sisson, thanks for joining us.
Thank you, Autumn.